the Filipino OBGYN Society. Now currently we're doing some campaign to promote awareness and to promote vaccination. There are two ways that we do it. We teach and educate doctors, and we teach and educate the lay.
The public.
The public.
Yeah.
Yes, okay. So when we talk about teaching and educating our doctors, before we would only do vaccination for children. We're not always encouraging vaccinating adults. Right now, we are encouraging vaccination not just for cervical cancer, but for all types of diseases that we have available vaccines so that we will live well. We all believe that an ounce of prevention is always better than an ounce of cure. That's why what we're doing is educating the physicians, the gynecologists, empowering the physicians so that we will vaccinate our people. Now on the other side, we also talk to the consumers, the public, and we try to do some lay education programs so that they would be aware that there are certain diseases that they need to be vaccinated, not just children but all adults here as well. Because if there is a prize or if there is a cure for cancer, then everybody, I am pretty sure, will go for a cure for cancer.
Absolutely. But so educational programs, both for doctors, for children, and the public in general. But let's take it a step further. Besides education or providing information, you also have screening and the actual vaccination programs. Yes, Dr.
Our society is the Society of Gynecologic Oncologists of the Philippines. So we actually take care of women with cancer. So just to give you a background, when we first the good thing with the vaccine being available is for the longest time we knew what causes cervical cancer, right? Because when you're diagnosed, the first thing you ask your doctor is, what caused this? What could I have done to prevent it? So for the longest time we've been frustrated because we knew what caused it, but we had nothing to stop it, no? Except for screening, which in the Philippines, unfortunately, we only have 9% of women who are screened. We don't have a national screening program.
That's so small.
Yes, that's why, as Dr. Ancela mentioned, the society, our mother society, has worked hard to reach out to women for screening. However, until we get the national program going, and our societies have been working, trying to get the health authorities to listen to us so that we will have a national program. We have started empowering or even teaching our midwives to do screening so that we can reach more women. However, still, until we have a national program going, then we have what we call opportunistic screening, which means that that's why we're asking you to spread the word for each woman to be screened, because it's the only way for now. Because the next one is...
Dr. Can I just put up some numbers out there, just taking off from where you just said? That's alarming for me. Because we were saying 80% of Filipinas or women are affected, and only 9% are screened.
Yes.
That's very alarming, huh?
Yes, because there's a WHO study that looked into how many among Filipinas are screened. No? So we have an at-risk population of the reproductive age women, which means 15 to about 65. So the at-risk population is about 28 million in the Philippines, but only 9%, 9.8 actually are
Let's change those numbers,
Yes.
please. Your information, your write-ups, your talks with your girlfriends, that will go a long way.
I think the reason why it's difficult is because the screening requires pap smear examination.
Ay, natakot.
And I'm going to throw the question in this room. How many of you here has had the pap smear this year or last year?
It's supposed to be once a year, huh?
Yes.
You're
See?
supposed to have a pap smear once a year.
Exactly. So because our culture is prohibitive and Filipinas on the average don't want to do that, that's why we have a low screening profile.
There are sizes, guys. Don't worry. Ask for yung pang virgin, yung maliit. I'm making it light of you, but trust me, don't be scared. Inuunahan na naman kayo ng takot eh. Diba? That's why we're informed. And take it from me, my virgin size. So don't be scared.
It's not painful.